The creation of Gold Star Network came as a result of a felt need. We realized that there was a significant number of HIV-infected patients who are able to pay, but because of stigma and long delays in accessing care in the public sector, they were seen as a gap in the provision of health care. Gold Star Network felt that it is important to work through KMA that was enjoying a membership over 2,000 registered members and other members who are associated with the KMA. Firstly, we had to do a needs assessment. Several private clinics were assessed from Nairobi up to the neighboring Thika district. Here the issue of branding of the outfit came up, the issue of the fee that is to be charged, and the issue of the composition of the network. So finally it was agreed that there shall be a network of private providers, there shall be a network of pharmaceutical outfits, and there shall be a network for the lab. Then later on, we brought in the network for the counselors. Through Gold Star Network, a lot of successes have been realized. We have been able to train a big number of members. We have been able to create practicum services. For example, this hospital, Bagati District Hospital, has always served as a practicum facility for the trainees. The other success is we have been able to put into care close to 6,000, over 6,000 patients are now benefiting from the Gold Star Network. Gold Star Network has been able to create a network of quality laboratories within Nairobi and Mombasa. We've been able to provide counseling services to the same. It started with the doctors. Gold Star has now spread to involve clinical officers. And we have several clinical officers that are now in the network. Apart from standalone clinics, Gold Star also created a network of institutions that are providing HIV care. For example, the MATA, the Karen, AAR. These institutions are now actively involved in the network. Some of the challenges that can be faced is that there is a high turnover of personnel, especially the lower cadre. So some of the ones who have been trained could be going out of the country. We are yet to know the actual number. So there is need to have continuous training. There is need to have continuous recruitment of members. The other significant breakthrough with the Gold Star Network is the provision of continuous medical education. Gold Star Network has been able to spearhead, accredited continuous medical education, which has been very useful to our members to be able to be kept in the retention list of the medical practitioners and dentists. Whereas in the public sector, most health workers were using the national guidelines, like the Bible. In the private sector, this was not the case. But after the training through Gold Star Network, it has been very easy for the private sector to provide quality HIV care using the national guidelines. This has been very useful because when patients cross from private sector to the public sector, they don't have to change from one regimen to the other. The second point is that the increase in the number of cases that are registered by National AIDS Control Council, both adults and pediatric, GSN Network has made a significant contribution to that number. Gold Star has been able to lobby for access to drugs by the private providers through NASCOP and through PEFA. And this has been very useful. And this is not only for the HIV drugs, but also for the TB drugs. Because as you know, the co-infection rate is quite high. And this has made it very easy for the patients to access quality HIV care. With the devolved system of government, the future is still bright, because the headquarters can still deal with policy and deal with the Ministry of Health, but the old structure where we had Rift Valley, Coast and Nairobi can still work with the counties without much difficulties. KEMSA has actually opened a private window where private sector can actually access drugs that they at a cheaper price as compared to what they have been going for. The new structure at KEMSA, where now you find even county governments are drawing their supply from KEMSA Direct. I think this is going to speed up the turnaround time for the delivery of drugs and other supplies. The beauty of this is that it will make the other commercial supplies bring down their prices, because the prices at KEMSA are quite low, and this is going to do away with monopoly, and monopoly brings with it increases in costs. Most of the development partners that have been supporting the laboratory network are still there, and the laboratory network has not been affected much by the devolved system of government. So we do not expect a big problem. As far as counseling is concerned, what is important is the guidelines. And we have a national guideline on HIV counseling and testing. So depending on where one is trained, so long as they are familiar with the guidelines, that is the only way we can guarantee the quality of the testing. The biggest challenge to people seeking healthcare in the private sector, one, is the cost. Because in the public service it is free. Number two is counseling is limited. Number three, sometimes it's privacy, because you find sometimes you find the standalone clinics are not so spacious. Sometimes you find the doctor is the counselor, is the nutritionist. So the quality of that kind of care is not compared to the public sector, where you are seeing different, multidisciplinary. Private sector is thin, it's less multidisciplinary. And that is why the creation of Gold Star Network was good, because when they created that psychosocial counseling, so the standalone clinics will refer patients to the counselors for detailed counseling for purposes of follow-up and continuation of care. More than 50% of HIV-infected patients in this country that are just on care. The role of a private provider is to fill the gap for those who are able to pay because of confidentiality and sudden delays in the public sector. And sometimes the environment in the public sector might not be fitting their status in the society. The answer to HIV care really is to have resources, because the partners are supporting the government and the government is supposed to top up. There must be significant increase in the health budget to be able to cater for HIV care. The private sector and the public sector must partner and share the risk. Gold Star Network is one of the most unique franchise, and the starting point was Kenya Medical Association. It has opened the way now for other associations, and I think it is important that now we should scale it up to involve more health workers so that we can reach more patients and contribute to the increase in equitable access to care, improve quality and responsiveness of health services, foster partnerships, for quality health care.